Um, no, thank you for joining us today. I'm just thrilled that we have 4 of our stakeholder participants in our first state-level project ever, the California Health Reform Initiative, joining us today. We have 3 here in the conference room with me, and Doozy is in the process of joining Bill Kramer on your video screen. He'll be joining us remotely. The first convening of the California Health Reform Initiative was on October 16th, 2018, 17 months ago. Close to 20 of us met in the public library in Sacramento, just a couple blocks from the Capitol. We spent all day together. We ate lunch together and ended with a reception. At that point, most of you were relative strangers to me. But now, I think I know about most of your kids, your parents, your vacations, and that Bill Barcelona knows a really good donut shop in Sacramento. It really has been a marvelous, marvelous journey over all of this time. So I have served as the project director. Don Collier in Sacramento has served as our project associate. Daniel Bowling was our senior project advisor. Paige Morrissey is our current intern. Nikki Lanshaw, who's now at the Kaiser Family Foundation, is online. He was a former intern, as was Saida Rui, and we have relied on all of them to get us here. Mark Zitter, who will be moderating our next panel, was an expert advisor to us and to me, and I am tremendously indebted to him for sharing his health policy expertise with me. But our stakeholders, they are a truly magnificent group, and they are a broad and diverse group in many different respects, but certainly cross-sector. So these people, as you can tell by the fact we started in October of 2018, they were relentless. They really stuck with this project through, the ups and downs, and as we're getting closer, 2 steps forward, 1 step back. And I really want to thank you all for doing that. Their passion for health in the state of California is sincere and extreme, and their expertise is substantial. And they've stuck with it so far. We have wrapped up our dialogue phase and are pivoting toward our action phase, as you'll hear about in a moment. And one of the other things that struck me about these folks is that many of them have worn many different hats throughout their careers. So let's meet them. I'm going to ask each of you in turn to tell us a little bit, they have your bios, but a little bit about the different roles you had in the healthcare sector, and then what brought you to this table? Why did you choose to spend a lot of your valuable time on this project? Maybe first we'll start with Bill Kramer online.
Hi. Hi, Vicki, and everyone who's here today. Really appreciate the opportunity to participate, even though I'm several hundred miles away. As you know from my biography, I've been involved in healthcare for several decades. I've worked both in the public and the private sectors. I've worked with health plans, with provider groups, and with hospital systems. I worked for Kaiser Permanente for many years on the business and administrative side. I also had an independent consulting business working with large health systems and health plans, and now work at the Pacific Business Group on Health, a not-for-profit organization representing large employers. And what this is, the career that I've been privileged to have has given me an opportunity to see the healthcare system from all sides. And I think that's one of the things that's most important. Each of us brings some of that diversity of experience, but also collectively we bring that diversity of experience. I got involved in the Convergence California Health Reform Initiative because first, as we all know, there are serious problems in our healthcare system. Costs are much too high, making access to healthcare unaffordable for many people, crowding out wages, crowding out public and private investment. And at the same time, too many people still do not have coverage or access to care, quality is inconsistent, and serious disparities exist among different racial, ethnic, and economic groups. Second, while the problems are clear, the solutions aren't. Early in my career, I remember a statement I heard that has proved to be true in healthcare, that for every complex problem, there's a simple solution, and it's usually wrong. Healthcare is a very complex ecosystem, and it involves many stakeholders, nurses, doctors, pharmacists, hospitals, insurers, employers, consumer groups, labor groups, and so on. And in many ways, we're all part of the problem. And that means we all need to be part of the solution. I think the Convergence process recognized this, and it was an opportunity for me and all of us to engage with the other stakeholder groups who need to be part of the solution. So I've been very pleased about the opportunity to participate, pleased with the outcome of our work, and look forward to working not only with Convergence, but with all the folks that I've built relationships with through this process.
Terrific. Well, thank you, Bill, and thank you for joining us despite being hundreds of miles away. So yes, we have two Bills at our project, and it's a little confusing, but now I'm going to turn to my right to Bill Barcelona.
Thanks, Vicki. Hi, everybody. I'm Bill Barcelona. I'm the Executive Vice President for Government Affairs with America's Physician Groups, which is a professional association, not-for-profit, that represents clinically integrated delivery systems across the United States and in California, who take financial responsibility along with health plans to control cost and to improve the quality of patient outcomes. We used to be known as the California Association of Physician Groups, and after the Affordable Care Act was implemented, we found that there were a number of physician organizations and provider groups across the country who wanted to learn more about what we call the California model, which has been around for 30 years. It takes capitated payment. It's measured publicly and apparently on patient satisfaction and on clinical quality outcome measures that are then publicly reported through our Office of the Patient Advocate's website here in California. I came to the organization in 2005 and have been with them for 15 years now. Prior to that, I worked for 5 years with the newly formed Department of Managed Healthcare in Sacramento, which was established to oversee our huge managed care system in California, which now encompasses about 96% of our entire healthcare market. I lucked out with the job of figuring out how to control closing health plans and medical groups back in the economic shakeout between in the early 2000s.
Wow.
And that was my job, and it gave me the most amazing 30,000-foot view of the healthcare system in California. And it helped me develop real substantial grounding in healthcare policy while I was there. And I was grateful for the experience to be in that setting at that time. Prior to that, I didn't have any healthcare experience. I've been a lawyer for 34 years, mostly a litigator. And I came to healthcare because my oldest daughter got very, very ill when she was 2.5 years old. We got thrown into the healthcare system. It was a mess. And my wife had to spend months shuffling manila file folders, patient records from doctor to doctor, going to appointments that were canceled because the system was dropping. My daughter was falling through the cracks. And we were just very, very disappointed with the lack of organization. We encountered many, many well-meaning people, very good organizations who helped us along the way, but the system itself is fragmented, disjointed, and people fall through the cracks. And we made a decision as a family that we would step up and try to do something about that. And so that's how I got my career in healthcare. So an organization like this, an effort like this is a no-brainer. And I'm grateful to have participated in it. I look forward to future discussions and future efforts around this, this is definitely the right way to approach complex issues.
Well, thank you, Bill, and thank you for sharing that, and we're delighted you've been participating. So Laurel, tell us about yourself.
Hi, everyone. My name is Laurel Lucia. I'm the director of the healthcare program at the UC Berkeley Labor Center. I started off my career in healthcare as an internal management consultant at Kaiser Permanente. And then after I did my master's in public policy at Berkeley, I went to work for the Service Employees International Union, doing research on health policy and long-term care policy issues affecting workers in those industries. But for the last 10 years, I've worked at the Labor Center, which is a research center on the UC Berkeley campus that looks at a whole variety of issues affecting mostly California workers. We have a California focus. And I'm part of a team that focuses on healthcare. And for the last 10 years or so, a lot of our focus has been on effectively implementing the Affordable Care Act in California and looking at who still remains left out after the Affordable Care Act. So we've done a lot of research on the uninsured and undocumented Californians, covered California affordability issues, and the state solutions that could address those coverage gaps. But in the last couple of years, we've been trying to shift to doing more on the healthcare cost issues. Given that the majority of Californians still get their coverage through employment, and for those Californians, cost is the #1 issue. We really wanted to do more in this area. So when I first talked to Vicki about the Convergence process, it was kind of in the early stages of this pivot we were already making, and this seemed like a really perfect opportunity for me to kind of get a broader view and meet stakeholders that we haven't typically worked with. We work a lot with labor unions and consumer advocacy groups and immigrant rights groups, but I haven't had as much opportunity to work with providers and insurers and employers, and so I was really excited about being able to build those relationships and also develop a better understanding of the healthcare delivery system side of the world and the cost issues, and went into it not knowing exactly what our focus would end up being, but it ended up in the place I had hoped most that it would end up, both for my own understanding, but also because initially it seemed to me that healthcare cost issues is where there was the most potential for a process like this, because it's the area where I think we need the most work and there's the least consensus.
Mm-hmm. Great. Well, thank you. Gary.
Good afternoon, everyone. My name is Gary Cohen, and I actually came to healthcare and health policy quite late in my career, but through a series of completely unanticipated events, found myself serving in the Obama administration for 4 years, working on implementation of the Affordable Care Act, and ultimately being the head of the office that was charged with implementing the ACA in the private market, so drafting all the regulations, setting up the exchanges, and so forth. Came back to California in 2014, very much with a feeling that while the work we had done was essential, it wasn't enough. Having coverage is very important, but it doesn't necessarily guarantee that people are going to have access to care, and as the others have all indicated, cost remains a tremendous barrier for people to get access to the care they need, even if they have good insurance in many cases. So that was what I was thinking about when I came back in terms of what I would do next, and ultimately took a position as head of government affairs for Blue Shield. Our mission is to ensure that all Californians have access to health care worthy of their family and friends and sustainably affordable. So there was a good match with what I was interested in and what the company has been pursuing. And I think that the opportunity to participate in this process with Convergence was attractive to me in two ways. One was a very practical one, which is I was hoping to put together, a group of stakeholders interested in doing something around the cost of healthcare and really mobilizing to see if we can get something done through the state legislature, which is moving forward. I think we'll talk about that. But secondly, and as importantly, an opportunity to listen and learn and talk to and with a broad group of people from different parts of the healthcare system and get a sense of what their thinking is, what their imperatives are, what the pain points are, what the opportunities are, and so that was a big part of what interested me in participating in with Convergence.
Terrific, thank you. So you can see that these stakeholders are much more than the titles on the agenda, and it's really enriched our discussions. And these four alone would provide a very rich discussion, but in addition to them, we had Lanhee Chen and Tom Church at the Hoover Institution at Stanford, Jerry Kaminsky at the UCLA School of Public Health, Micah Weinberg, who is CEO of California Forward, Deborah Kelch, who's been Executive Director of the Insure the Uninsured Project. Sarah Phlox joined our discussions from the Cal Labor Fed, as did Lauren Kay from the Cal Chamber. We've had consumer advocates, including Anthony Wright, Executive Director of Health Access, Doretha Williams-Flournoy, Executive Director of the California Black Health Network, and Kiran Savage-Sangwan, Executive Director of the Pan-Ethnic Health Network, and Jen Flory, Policy Advocate at the Western Center on Law and Poverty. So you can imagine how rich the rooms were when we walked in to sit down and have these discussions. So let's talk a little about the dialogue process. As you know, Convergence focuses on developing communication channels, building relationships or strengthening ones that were already there, and basically to create a space for greater candor and greater creativity. And so my question is, did that happen? Were there encouraging moments? Or any particular instances that gave you hope as you went through this process?
Yes.
Yes? Good. Okay. I should just stop there. No. What gave you hope?
As you get to the end of the process, it obviously heats up quite dramatically, as you know. And I think having facilitators like you involved in this sort of a process keeps the communication lines open, leads to breakthroughs. But it takes a voluntary commitment on the part of all the participants, right?
Everybody,
and
yes.
That's something that we don't see a lot of these days. Mm-hmm. And so that's a great lesson in and of itself.
Terrific. Others?
I think the thing that as I look back over the many, many meetings, the thing that really has stayed with me is how well we all listened to each other. I mean, that to me was the really distinguishing feature of this process. People weren't, just kind of giving speeches and only interested in what they had to say. People really were, hearing each other respectfully, understanding that we were all coming from a place of goodwill, and as Rob said, agreeing on the goals, maybe not on the means, and I think that we coalesced around the goals very early, I think.
Yes.
From a very broad, like putting up a zillion things on a piece of paper that we could talk about, we pretty much focused. And then after that, it really was a process of working through, how to get there. And I just felt there are, as I said, I haven't been in healthcare that long, but there are people in that room who have been battling with each other on big, big issues for a very long time.
Yes.
And either because or notwithstanding that, I'm not quite sure, it was a very, I thought it was a very open, candid, and respectful process every time.
Yeah, I was struck by that too. I didn't have to break up any fistfights. There were barely raised voices. It was tremendously respectful, and that's a credit to all of you who participated. Bill, Laurel, anything to add?
Well, I with my earlier comments said that I was hoping that this process would lead to a discussion on costs, because that's where there seems to be the least consensus. So, but given that, I think we do have, some consensus now, and I think the report that will come out tomorrow is a testament to what is possible through this process, because I never would have guessed that the range of stakeholders that support this proposal would end up in this place. So,
Yes,
yeah.
great. So, and I should just add one footnote. We tried to schedule, as the process wore on, we tried to schedule around our state legislature so that if people had to go to attend hearings, that they were free to do that. So the state legislature adjourns midday Thursday. So we would meet Thursday afternoons and Friday mornings. Except one Thursday afternoon, I believe it was the Senate Committee on Health decided that was a good day for a hearing. And do you recall some of our stakeholders were stepping out of the room to go testify in opposition to each other on whatever was pending that day, and then would come back and sit next to each other and talk about our project. And that really struck me as sort of exemplary of the two different forums, right? And so it's a real credit to everyone that they could keep going in that instance. So our big news is that tomorrow morning, after all of this work, we are going to release our report and recommendation from this project. Now, when our forum today was originally going to be an in-person event with people having to get through security at a law firm, we knew who everyone was, I was going to hand out an embargoed advanced paper copy of our report and swear you all to secrecy. Now we're on the internet with an open event. So I can't share the document for another 18 hours. But what I do encourage you to do is log on to our website tomorrow. We will be issuing a press release in the morning. We will be posting the report. We will be tweeting. If you like what you read, please retweet, amplify, help us out after all this hard work from these folks. But here's what I can share with you today. So, in January, as we were finalizing our report, the governor issued his budget, and in it were several health-related proposals, and one of them very closely aligns with the product of the deep thinking that has gone on in this group. So I will share with you that, as was mentioned, you could hear the theme, the focus of our report is on containing healthcare costs and increasing the affordability of healthcare and insurance coverage in this state. And it looks like the legislature may take it up this term. So our stakeholders will have a lot to do in terms of getting out and explaining how they came to this result. So what I'd like to do is just ask each of you a little bit about that without giving away all the details, but I think it's fair to say we've centered on what we think is, well, not we, but what the stakeholders think is a good solution near term in California to address costs. So Laurel, your research focused, as you mentioned, on costs and the economic impact of healthcare policy. Can you tell us a little bit more about the why we should be focusing on costs and affordability?
Sure. Well, as others have talked about, costs here in California have been rising rapidly, like they have been across the U.S., and we spend a lot more in other countries per person than other countries on healthcare. And for California workers, what that means is a lot of them are struggling to pay their premium contributions. A lot of them are struggling with out-of-pocket costs, especially unexpected bills, and worrying about, if they're going to be able to pay their deductible. But I think it also means, and this is a less visible cost, that workers' wages have been growing more slowly than they otherwise would. The employer's contribution to health insurance means that they can't afford to put that money into wages. And so rising healthcare costs are not just an issue in terms of access to healthcare, but they have rising healthcare costs have broader economic implications for workers.
Thank you. So Bill Kramer, I want to go to you on the video conference because you've been in this fight for a long time. And I think at one point during one of our meetings, you said something like, darn it, I want to see something happen in my lifetime. And you were, and just, the work that you put into this, you're getting ready. So, so tell me, so why is it that passionate for you? Why is it so important to you that this group could come together in this broad way to address affordability in our state?
Affordability really is a serious problem. And Laurel, the research that she's done and she just described hits the nail on the head. It's not only is it a burden for employers, but it is literally taking money out of people's pockets because it's been holding down wages. The amount spent on health benefits is crowding out the money that could go into wages that could then be spent throughout the healthcare system, throughout our economy to encourage growth and reduce the inequities we see in our income and wealth distribution. It also crowds out private sector investment for businesses could be making to grow, expand, to innovate. And it crowds out public investment. Over the last 30 years, we've seen the cost of health benefits provided by the public sector, Medicare and Medicaid in particular, crowding out investments in education, in infrastructure, in public safety. Almost every category of public spending has been reduced in real terms over the last several decades, while spending on healthcare has gone up. And the maddening thing is that we know that we can deliver better health care for less, that increasing spending has not resulted in improved access or quality. We know that there are health providers, health systems, physician groups, and hospitals that are delivering outstanding care at a much lower cost. So we know it's achievable, but we have a system that has not rewarded those who are providing quality care at lower cost. So we can do this, but it needs everybody at the table to figure out how best to do it. That's what keeps me going at this work all these years, and I think that's true for many of us here in the room and throughout the healthcare system. But we need to make some tough choices, and we need to work together to try to find solutions that make sense. And I think the outcome of our work is an important step in the right direction. If we follow through on this, California can become a leader in finding ways to understand what the problems are and really seriously tackle the problems of affordability and quality.
Well, Bill, thanks for being in the fight for so long, and thanks for coming together with the folks in our room. Now to the other Bill. You represent a tremendous number of physicians in this state, and from time to time probably find yourself on opposite sides of some of the folks. And so what I'm wondering is, what's different about this issue that there's alignment, or at least you can find yourself in agreement with consumers and insurers and others with whom you might sometimes not see eye to eye?
Well, let's start at the top. When you're in a healthcare organization in California, you have a lot of employees and you have to provide coverage to those employees. And guess what? It's just as unaffordable for our organizations as it is as everyone else.
Wow.
So it's an issue that affects, as Bill said, everybody's bottom line. It's fundamental to the sustainability of our economy, our culture, our society. We're in a very complex situation now since the Affordable Care Act. You know, as one of our colleagues, Michael Weinberg, pointed out a few years ago, the primary employer in most cities in California is now a healthcare organization. And, you know, we owe 360,000 jobs in California to the implementation of the Affordable Care Act. So it's not surprising to think that we have got to address quality and affordability at this point. for the sake of everybody, including our own provider organizations. So that's the simplest answer.
Simple is good. And maybe in this instance, it's right too, to quote Bill, the other Bill. So Gary,
Yes.
save the best one for you. In our group, we have both single payer advocates and single payer opponents. Why do you think we were able, nevertheless, to come together on this solution to address costs and affordability in our state?
So I think I would give two answers to that. The first answer is that, in my view, much of what is driving the desire for dramatic change in the healthcare system actually is cost. That's really, you know, a lot of people are favoring a single payer solution or Medicare for all solution because they believe that it will lead to reduced costs. Whether they're right or wrong, it's not the point. It's just that's the impetus for it. Mm-hmm. So I think that when you bring a bunch of people, so that's number one. And then number two, I think there was and has been a very clear commitment on the part of the consumer advocates and labor and some of the other folks who participated in this process and are supporting what the governor is proposing to not let what they are hoping happen in the long term prevent us from doing some things that we can do in the shorter term to actually make a difference for people. And I think the issue has gotten to be acute enough. And labor is a really interesting player in this because they have healthcare workers and they have to pay. They have healthcare plans. They have labor and trust plans. So they're paying for the cost of healthcare for employees, and they're also working in. They are workers in the system, and so they have to look at this from a very holistic point of view. In terms of how we can, make progress here. And I think there really was a commitment on everyone's part to say, we may have huge structural battles to be fought, over the years to come. But in the meantime, we're very fortunate in California that we have a consensus that everyone should have access to health care. And we have a consensus that government has a role to play in making sure that happens. That's not true everywhere in the country, obviously, but we have that. We don't argue about that in California. So it really was very much, again, a situation of, we share these goals, and we even share to some degree, what the mechanisms are to achieve them, and then it's just a question of how do you get down into the specifics and the policy and some of the details.
Mm-hmm. Great. Okay. Well, before I turn it over to questions and answers, I have one last question for any of you, and that is, what do you think might be the lasting impact of this process? And what I mean is, we talked a lot about relationships. We talked about, I think Bill Kramer mentioned California often as a leader in a state, as a state in the country. We're a very large laboratory. In your crystal ball, looking forward over the next few years, what impact either from the process or from the product do you think this process might have had?
Well, I'll start. Number one, I hope we pass legislation, this year in the governor's budget to create this entity to address cost of healthcare. I think it will be a big deal. It's a step. It's not the be-all and the end-all, but it's a step. It's an important step. And then secondly, I do think that the relationships that, certainly for me, again, not having known everybody, as well or for as long, the relationships that we've created, I'm hoping will continue to be meaningful. And, I know that I can turn to anyone who participated in this process over these past, 17 months and have a conversation at a different level than I could have had before, just as a result of having worked together and worked toward reaching agreement on this.
Terrific. I'm delighted. That's music to my ears, and I certainly hope that is the case. Anyone else want to comment on?
Just to build on what Bill Kramer was saying earlier, I think the solution to this problem ultimately is it's a shared responsibility approach, and processes like this lead to that kind of an outcome ultimately.
Excellent, excellent. Okay, so Doozy, do we have any questions
We do. One moment.
for our panel? And I think they have instructions, they know how to send them in. Is that...
Suzanne, would you like to ask a question?
Sure. Thanks so much for sharing your stories and kind of the model. It's really helpful to kind of compare notes, how we do it, and also learn from other folks in terms of their structure. My question is, you know, part of what we prioritize in convening cross-sector problem-solving dialogues is being really intentional about bringing diverse experiences to the table. So I can't help but notice, right, that all the panelists here on this call look like me, probably, right? So I'm curious, you know, do you consider equity and inclusion how you seat a problem-solving circle and who you pull in? You know, do you have people with lived experience as a part of the conversation, et cetera? That's really for any of you, I guess. Thanks.
Somebody want to tackle that one?
I think it was probably more for you about who was brought in, right? Or
The diversity of the stakeholder group.
Yeah, so let me just, there's another question. So we have a couple of questions along the diversity of the stakeholder group and how we assembled it. So I should back up for a minute and talk about Convergence process is really a three-part process. So we start with an assessment phase, and then we move to the dialogue phase that we've been discussing, and then we move to an action phase. So we're not just a round table, we'll have the action phase. But for the assessment phase, what we do is we start asking questions, and we start listening, and we start asking the stakeholders whom we know who else they're talking to and who needs to be at the table to represent all interests. And we, in this instance, issued invitations across all the sectors that were identified to us as important. Not everyone accepted those invitations, but there was not a sector that was not represented. So what I mean by that is, well, you can see here today, we have insurers, we have providers, we have employer payers, we had workers, we had consumer groups, we had experts like Laurel and other academics. We would not have gone forward if we could not have had those voices. Was it perfect? No. Was it absolutely comprehensive? No. But we also made up for that sometimes by bringing experts in. One of the things we didn't talk about is that we brought in to our table the head of the Massachusetts Health Policy Commission. We brought in the head of Maryland's commission. We brought in experts from the California Healthcare Foundation. So in terms of diversity of perspective and experience, we cared about that. In terms of, we tried also to get racial, geographic, and gender diversity, and we did our best. And I think that, I don't know that there were large omissions, but did we have every single voice? No, but we did have the breadth of perspectives. We had, Lan Hee Chen from the Hoover Institution and Laurel from the Cal's Labor Center. So I think those perspectives were well represented. Others? Let's see. So the question is, we mentioned the governor coming out with this proposal that aligns closely with ours.
I thought just
and the question was, was that completely coincidental? And the way I would answer that, and our stakeholders live this, but I want to say, at Convergence, we look for the best ideas. We ask you all to bring the best conversations and ideas to our table. And if there are other conversations outside our table on similar topics, we're not going to say we can't talk about it here, perhaps all the more reason. So, were there other conversations? I'm aware of some. And, you know, if you have several smart folks talking in different venues and come up with the same idea, you know, I think that's all hopefully wind beneath each other's wings. I don't know if any of the others have something else to say.
I would just say that the time that we started in toward the end of 2018 was a time of a great deal of activity and ferment around health policy in California in anticipation of the new governor coming in with the belief on many of our part that it would be Gavin Newsom who would be elected, and that if it were, healthcare would be a huge priority issue for him and his administration. So this certainly was not the only place where there was a lot of conversation going on around what could we do around healthcare in California. There was a lot of it. And some of the issues that we were engaged in figuring out policy positions and advocacy were similar to the ones that we talked about through the convergence process. Some were different. I mean, you know, there was a range of things that were on the table and continue to be on the table. We didn't spend a lot of time in this process, for example, talking about reforming Medi-Cal. Huge issue for the state right now, you know, that the governor and his folks are undertaking. So I think it's fair to say that we began this process at a very fruitful time where there were a lot of things happening and a lot of, I'm going to mix my metaphors, flowers blooming. We happened to arrive on, you know, and focused on a particular issue of costs and affordability that the people around the table all cared about. Not surprising, that's also something that the people in the Newsom administration really care about. And I remember the very first time I heard Health and Human Services Secretary Ghali speak after his appointment, he made affordability, you know, front and center in his remarks around what the Newsom administration is going to be addressing. So I think it was not coincidence, but it just was, you know, it was really part of what the zeitgeist, if you will, what was happening in health policy in the state.
Any, are there more questions from?
Not yet, but keep them coming.
So are there any things that you think, and I want to be careful, and I'm going to be bold, Rob, I'm going to ask this, are there things that you think we could do better? Or there are things that might enhance the communications in these meetings?
So this is something I've said to you at one point or another during the process, which is that I felt that there were moments where we were stuck and could have used a little bit more of a kick in the butt to move the discussion forward. You know, there's a tendency, and anybody who's participated in this kind of thing knows that you know, there are times when you're moving and making a lot of progress, and then you kind of stall out. You hit an issue that's difficult or sensitive, and you know, you kind of find it hard to, you know, progress, and you find yourself having the same conversation repeatedly, you know, with people, you know, just kind of stuck in their position. So you're a very empathetic and you know, really, you know, good at creating a nice atmosphere and all of that. But I did think there were times when we could have used a little bit of a kick in the pants and say, okay, folks, you know.
I relied on you to do that.
Yeah. Well, that's true.
Right?
That's true, you did.
I did. Thank you.
Look like Bill might have something.
Bill, Kramer, did you have something to add?
Well, I would agree with Gary, but that there were times where he seemed to be stuck or kind of circling the same issues over and over, but we were able to work through them, and I don't want that to overshadow the very positive energy in the room at the multiple meetings we had, and the stick-to-itiveness that the participants had, and the glue that you provided, Vicki. I know you did a lot of behind-the-scenes work as well as in-the-room work, and this was a tough issue we were tackling. Cost and affordability. You know, in other policy areas, it's possible to find a win-win among the stakeholders. You know, for example, expanding coverage helps consumers, of course, but it also helps hospitals and physicians, drug manufacturers, insurers, because it brings more paid business, more revenue. Tackling costs is a lot tougher. Because part of the problem is that some providers and drug manufacturers are frankly, charging prices that are much too high.
Mhm.
Tough to find a solution. It's tough to keep everybody at the table. And I think in some ways getting stuck with not just a process, it was a substantive challenge. And I think the process that Convergence has, the philosophy, the values that it brings, and the experience that Convergence brings to these tough issues really helped us here. We did have good individuals at the table. We do have a culture in California of trying to do this kind of joint problem solving. But these are tough issues, and we shouldn't understate how difficult it was and the importance of the accomplishment. Not only did we produce something I think is going to be very worthwhile, but I believe we are influencing what the governor is proposing, and hopefully can be influential as a group or in subgroups going forward to tackle these tough issues.
Well, thank you, Bill, for that. I share your hope, and I share your view of the room. It was tremendous to see people persist through this. These are issues we've been stuck on for decades, and we try to provide a good place and space, but it is a challenge. And I want to also give kudos to all of you, because we've been talking about the convenings. There's so much more that goes on in between them. We've had countless video conferences for an hour or two here or there. I've had individual calls, I think, with each of you, even on a Saturday morning. We've had emails of drafts back and forth. We had working groups that you participated in the interstitial time between our all hands meetings. And so these people have put in a tremendous amount of effort, both at the convenings and in between. And that is why I think that even when we'd get stuck, we just kept pushing. We just kept talking. We just kept trying, and we got there. So I want to thank you all. And I think are we at our time? Pardon? Oh, is there another question? Oh, okay. There's another question.
We have a few more questions.
Oh, we have a
We'll
few
just
more.
do some quick answers to these. Where did they go? Ari, would you like to ask your question now?
Sure. Just first, thank you all for all of your hard work over this extended period of time. I'm curious, when you think back on the collaborations and the work you did, what voice would you most have been in the room that was not there?
Well, there were a lot of people in the room at the beginning of the process. We lost a lot of colleagues along the way, and that's part of the process as well, right? For a lot of reasons. And difficult conversations are difficult, and not everybody can hang in into the end, but it's nice to have a forum where you can exercise that level of commitment. Sometimes commitment is an end in itself, in a way.
Nicely said. Oh, well, that's interesting. I'm asking you, me to do it. So we have another question that said, how can what we are proposing to do be rolled out to other states? It's something we certainly didn't talk about, but we did talk about California as a leader. Any thoughts on other people watching us do this?
Well, sure. I mean, so what the governor proposed is modeled on something that Massachusetts implemented some time ago. So it's not unique or didn't originate with us or here in California. But I do think, as often happens, if California does something, it attracts notice. I think that time will tell. I mean, if this gets passed this year, it won't be actually in effect operating for another couple of years. So it's going to take some time before we actually see. One of the challenges of public policy altogether, but certainly, in this area is you don't necessarily see the results of what you do, for some significant period of time, later. But I do think that, if this happens here, it will certainly be noticed, it'll be written about, it'll be, talked about, and we could expect that it's something that other states might be interested in.
Great. Okay.
And you can take it on the road, Vicki, you can get a.
There we go.
You can rent a bus, you can't fly, so you can rent a bus. And you
Just
can
get a
travel
new school bus.
One down, 49 to go. We'll get like concert t-shirts, Vicki's tour, Vicki's health tour.
Cost containment tour.
Okay, yes, there we are. Cost containment
Yeah.
tour.
From the
All right.
Stankesia Estate.
Well. So you can see that sometimes they get unruly. So no, we thank you all so much for joining us today on this panel and sharing with our audience the experiences that we have shared in this room. I am personally tremendously grateful to you on behalf of the organization. I am grateful to you as a Californian, and I look forward to working with you in this next stage as we take our recommendation public and share it with the lawmakers in Sacramento. Thank you so
Thank you.
much.
Thank you, Vicki. Thank you.